All right, hello to my CRMC community. This is Dr. Ann Johnson here to discuss basically some relevant updates and then just a brief overview of relevant information with birth control and contraception. So this slide, I'm just kind of talking through what my goals of the talk are going to be and my outline. So we're going to review the different types of birth control and how effective they are. What are some other uses for contraceptive agents? Brief overview of the options for prescribed birth control, kind of slide by slide of the different options out there, and then who's eligible for various types of birth control. The main kind of points I want to hit home today are some of the updates that are relevant to contraception. I'm going to summarize them now and we'll talk a little bit more along the way. The first is that the Mirena or the Liletta, those are different types of IUDs. They're now approved for up to 6 years of placement, which just happened last fall. An FDA approval for used to be 5 years, now it's 6. And then there are some newer agents on the market as well. There's an option called Enerva. It's similar to the NuvaRing, which is an estrogen and progesterone containing vaginal ring. There's Slind, which is similar to Micronor, which is a progesterone-only tablet. The Slind has a benefit of a little bit more flexibility as far as dosing goes. And then the Phexxi is a vaginal kind of suppository that's used to alter the pH right before intercourse to prevent pregnancy. So this is a very busy slide just discussing there's many approaches to family planning, starting with natural family planning or fertility-based awareness methods. There are barrier methods, and then moving on, what's bolded are kind of what we're going to focus on mostly today, different kind of medically or medicine types that we prescribe. And then lastly, there are sterilization options as well. This is a nice little graph just kind of illustrating the various types of birth control and what they look like. The very top in orange there are the kind of most effective forms, and then as we move down to the lesser effective. If you pan over to the right side of the screen, what is your chance of getting pregnant? We look at different types of birth control in a couple of ways. One is perfect use. Let's say that you're prescribed the pill and you do an awesome job of remembering to take that pill every day. That's one way of looking at the effectiveness. And then there's something called the typical use. You know, we're all human and we forget things at times. And so I think it's important to kind of think about these options in the typical use form, and that's what they have here. So the very top options are the most effective because they really don't allow for a lot of user error. Things like the implant, the Nexplanon, that's what goes in the arm. Different hormonal IUDs and copper IUDs, those go in the uterus. And then obviously sterilization, which is a surgery. None of these options do you have to think about or remember to do anything to maintain. You get the procedure or the implant placed, and then you move on with your life for a period of time or forever. And then moving down, the pill, the patch, the ring, those are all different estrogen and progesterone estrogen and progesterone formulations, the Depo shot. And then there are other kind of either non-hormonal or other approaches to preventing pregnancy. And then, you know, it's important that we talk about these medicines a lot as birth control, or the other name for that is contraception, but really they serve a huge purpose in our GYN armamentarium. We use them a lot to treat these different diseases here. So if you have heavy menstrual bleeding, if you have painful periods, that's dysmenorrhea. If they're irregular, if you have amenorrhea or oligomenorrhea, that means you don't bleed regularly or predictably. If you frequently get ovarian cysts, if you have PCOS or polycystic ovarian syndrome, endometriosis, PMS, acne, there's all sorts of reasons that we sometimes lean into these agents to help manage these different symptoms or diseases. All right, so now we're going to take a stepwise approach through the various types. The Nexplanon is the rod that goes in the arm. As you can see here in this image, it's smaller than a matchstick. It's flexible. It is barely palpable underneath the skin. It works by suppressing ovulation and thinning the endometrial lining, and so that's how it prevents pregnancy, is because the egg never meets the sperm, and so pregnancy is not achieved without ovulation. It is something that is in place for 3 years per the FDA. There is some data that it might be good longer, but that's typically what we recommend is for 3 years. It is actually the most effective form of birth control out there, even more effective than permanent sterilization. So, and the benefit obviously is it's reversible. So you have very reliable birth control for 3 years, and if you want it removed, then you can conceive down the road when it's right for you. Some of the downsides, it can lead to some abnormal bleeding patterns in some women. Some women have improved bleeding patterns, but sometimes it is a little bit just some annoyance type bleeding. Next is the progesterone containing IUDs. These are things like Mirena. That's probably the one most people have heard of. Comparable IUD is the Liletta. And then there's some lower dose progesterone options like the Cuyuna or the Skyla. These options work by thinning the endometrial lining and helping to prevent at the level of the cervix, the semen from even entering into the uterus. One of the big updates here is that it is now approved for 6 years. Like I said earlier, it used to be 5. We use this option a lot. It's a good long-term option, can help a lot with painful or heavy bleeding, and it's user-friendly. Once it's placed, you can just kind of move on with your life. And moving on to the copper IUD, it works by kind of inhibiting sperm motility. It is FDA approved for 10 years, so it can be in place a long time. It's one of its upsides is it's non-hormonal, so people who want to avoid hormones can use this choice. It does have the downside of can make your periods a little bit heavier or more abnormal or painful. The Depo is an injection that you get every 3 months. You come into clinic to get an injection, and it works also by suppressing ovulation. Over time, people end up with less menstrual bleeding. There are some downsides. There can be a delay to fertility. It can alter bone mineral density. And of all of the contraception agents out there, there is maybe some data saying that some individuals might be more prone to weight gain on this option. Next is the pill or the oral contraceptive pill. This option also works by suppressing ovulation. It has to be taken every day. Upsides are predictable bleeding. So usually, you know when you're going to get your menstrual period on those placebo or the different colored pills. Downsides, they do contain estrogen, and so sometimes people have different contraindications to estrogen. So it's important to let your doctor review your medical history to determine if you're eligible for this option. These can be taken in a traditional approach where you take usually about 3 weeks or a little longer of the actual medicine and then a few days or a week of the placebo pill, or you can carry on and do this as an extended cycle and attempt to avoid menses, essentially. Avoid withdrawal or bleeding. Next, we're going to talk through the vaginal ring options. These are very comparable in kind of the nature to birth control pills because they have both estrogen and progesterone. They also suppress ovulation. These options usually stay in for 3 weeks and then come out for a week. NuvaRing has been on the market the longest, and as I mentioned earlier, the Enerva is a new one on the market. It's just one ring that usually stays in for 3 weeks and then is out for a week, and then you replace that same ring. As you can see, it's relatively small there. These are comparable in these images to the size of the hand there. They're very flimsy and flexible. You shouldn't know that they're in there once they're in. So the patch is another option that's similar to the pill in composition. It has both estrogen and progesterone. These are applied weekly, and you generally rotate sites for placement. Then there are progesterone-only pills for folks who want to avoid or aren't eligible for estrogen. These options also work to suppress ovulation and an array of other features that help to prevent pregnancy. Historically, Micronor was what we typically prescribed. You had to be very, very strict about remembering to take the pill pretty much at the exact same time every day, otherwise run the risk of breakthrough ovulation. The new medicine I mentioned, Slind, on the market, has a little bit more forgiving of a window of administration, so that's going to be the upside for that medicine. There can be some breakthrough bleeding with these options as well. And then Phexxi is another new one on the market. This one works to alter the vaginal pH so that sperm motility is a bit hindered. Typically, it's used within an hour before intimacy. Good because it's a non-hormonal option. Its downsides, though, is it's not really as effective as some of these other options that we talked about. Still probably better than no birth control, but somewhere depending on the studies, in the 80s to 90% effective. And then these next 2 slides are very, very busy. I just want you all to know that there are big charts that we as doctors often reference, and you can have access to them as well through the CDC's. It's called the Medical Eligibility Criteria. There is an app for it as well. It just basically lists off, you can see all these different conditions that a patient or person might have, and then it talks through kind of how eligible they might be for various types of birth control. Some of the acronyms are hard, but over on the right is more of the estrogen-containing options, and then all the other ones are various approaches to progesterone only. Here is another displayed chart with various other conditions. And that's a wrap, you guys. I want to point your attention to some various resources. This bedsider.org is one of my favorite resources to direct patients to when they have questions or trying to figure out what type of birth control is best for them. Very user-friendly. There's also these other 2 websites as well that will provide more information. Thank you for your time.